Hello, everyone, and welcome, birthing persons and birthing partners. My name is Jayni Angeli. I am a birth and postpartum doula. I'm also currently a nursing student working on my goals of becoming a midwife. I want to use this platform to give some information to really help make you have the best birth experience possible. So today's topic is going to be about the first 2 hours after your baby arrives. So this will be specifically on after a vaginal delivery at a hospital. So congratulations, you just delivered your baby. Now what? There are a series of things that happen directly after your baby is born. And the first thing is, and the most normal thing to do, is hold your baby skin to skin close to your chest. That is the most normal and best place for your baby to be, unless there are other extenuating circumstances where baby might need a little bit of help breathing, etc. But the best place for baby to be is right here on your chest next to you, skin to skin. From there, there'll be talk about cutting the baby's cord. And before that, in your birth plan, you may want to decide, is your partner going to do that? Or is that something that nobody's interested in and you don't have to worry about? But there is a specific amount of time that you should wait until you do cut that cord, and that is called delayed cord clamping. I am going to stick some links down below to give you some best evidence-based information on why it is good to delay your cord clamping for your baby. A lot of practices consider a delay anything after 1 minute. Anything before that is early, the time between 60 seconds to 1 minute and about 5 minutes, or until the cord has stopped pulsating. The delivery of the placenta can be anywhere from 5 to 60 minutes. It can take some time for your body to ramp up again with some minor birth waves or contractions to help get ready to push that placenta out. There are some options here. Some midwives and doctors like to give Pitocin. Pitocin is a substance that is used to help your body to cramp and or contractions to continue. That way your body can help push out that placenta. Anything that is left inside would need further medical attention. After the placenta is delivered, your midwife or your obstetrician will take a look and see if there are any repairs that need to happen. Now, please do note that this experience can seem uncomfortable during this time, and it's very, very tender down there. But there are things that your doctor can use to help with that, to help numb the area. If you can feel it, that is very, very important to let your midwife or doctor know that you can feel those sensations down there, and you are allowed to ask them to stop if it is really hurting you, because it should not. Ask them to stop and ask for some more medication to help alleviate any of the pinching or pulling that you might feel. It is natural to feel some tugging and some pulling as they go through and start to suture, but it really shouldn't be too terribly painful. Once the examination of your pelvic area and your vulva has been examined and repaired, your OBGYN or your midwife will do a nice quick sponge cleaning of that area and put your bed back together. That way you can get comfy and continue to hold on and cuddle your brand new baby in your arms. After you're cleaned up, a cool thing to do is your doctor or your midwife will show you your placenta. So you get to see the ins and outs of where the baby was and what was attached to you, and they'll just check and explain what your placenta looked like and how well it was performing for you. And at this time, you can also decide and tell them if you are going to keep it or if they can get rid of it. We call this time with your baby the golden hour. It is really important just to hold your baby here, and you get to observe and start to take some pictures with your partner. If you have a doula there, they can take those pictures for you, and you're waiting for that time next to happen where your baby is going to start looking and wanting to feed. If it's your plan to breastfeed, that is something that your nurses and your doula can help you establish at this time. Some key signs that your baby may show to let you know that they are ready to nurse are sticking out their tongue, or putting their hands to their mouths, or even start to bobble their head up and down. They can smell your breasts, and they can even maybe make the breast crawl to try to have them nurse on their own. They're just so smart and so intelligent just from the very moment that they're born. I do want to note that after your baby is born and after your placenta is delivered, you will have a nurse coming along and doing some pressing in your abdomen, kind of like pressing here, but in your stomach area. And what they're checking for is to make sure that your uterus is starting to shrink down to its normal size. This is going to help prevent any further bleeding and making sure that your body is doing what it needs to do to go and heal and be the best version of itself. I do want to let you know that this does happen every 15 minutes. So it is the most uncomfortable part after having a baby, but it is necessary, and it is really, really important to do, even though it is uncomfortable. But it's all with the best intentions, and nobody loves pushing on your tummy after you went through so much. After breastfeeding has been established, a nurse will also come in at this time and ask you about how long was baby breastfeeding and things like that. And then they're going to ask to do those important things of weighing your baby, measuring how tall they are. They're going to talk about doing an eye ointment and a vitamin K shot, and even talk about a Hep B shot at this time as well. I will put links in the description below. That way you have some informed decisions on if you do and do not want to pursue these things with your child. After baby gets weighed and measured, this is the time for your partner to get to hold baby and you to nourish yourself, because my goodness, you are going to be hungry. If you have a doula or your partner or a family member there, it's always good to kind of get your food in and ordered ahead of time, even maybe when you're breastfeeding or just before you're done. That way it's there and ready to feed you, because my goodness, you just did so much work. You are going to be starving, absolutely starving. Once that is all done and the birthing person has eaten, it is time to get you to the bathroom, maybe get a new gown on, a clean one, get a little more cleaned up. If you would like to be in your own clothes at this time, you are more than welcome to do that, or just a new robe, and someone will bring in a wheelchair for you. Your doula will have your stuff all packed up, or your partner will have all your stuff packed up, and we'll get you on a seat and off to mother baby, or recovery is what they call it in the hospital, and that is where you'll spend the next 24 to 48 hours before you get to go home. I know that was a lot to take in. There's a lot that happens in such a small amount of time, but I wanted to give you that information because it's that moment in time that isn't talked about a whole lot, and people just wonder what is next. So there it is for you, some good tasty nuggets of information for you. Thank you so much for listening, and make sure you like and subscribe to my channel.